You fill your mouth with words and words. You twist them well. Oh yes, I heard. Shits and ties don't cover your life. I see you come. You try. You know me, you say we get the same society. You know me, you say we get the same philosophy. You know me, you say we get the same society. You know me, you say we get the same philosophy.
And thanks for joining us on the Baroness. Today, as always, is going to be exciting because we're going to scratch those areas once again, as we always do. Those questions that are silent, sometimes I'm sure you wonder, how do we get to know you're asking such questions? Yes, we know because we are just like you. We're part of you. We move amongst you, so we know what it is. So today we're going to do something, and we're going to discuss something very interesting. Just call your friends, this is one time of the day that you need to sit and just watch and get educated, get challenged, and every, like we will always say. It's the Baroness, like I said. My name is Beyidmoa Nyam. I am not alone today. The house is full. Maybe that's why I'm smiling from one side of my mouth to the other. I have Nene. Is looking pinkish purple, but I like how you're looking at it.
Thank you.
Fine.
Oh, thanks. I'm blushing, even though you wouldn't show. Hi, it's good to have you join us again today on the program. There's never a dull moment on the Baroness, especially when the house is full. And I know that today it's not going to be any different, from any other day that we usually come your way with interesting topics of discourse. And as Beit has said, why don't you sit tight, call your friends, and even those you can call on phone, ask them which station they're watching. If they're not on PRTV, tell them to tune to PRTV because there's something for them.
Yes, and Anita is looking royal today.
As always.
Yes, honestly, you're looking really sweet.
Thank
simple
you.
And just fine. Yeah,
There's a lot of gorgeousness in simplicity.
exactly.
Good to have you join us, viewer. It's really awesome when all of us are together on the Baroness. And like Beit and Nene have already said, this edition of the program promises to be one you will not forget in a hurry. We have lots of exciting things to share with you, information that you have been looking for. We have it right here, and we'll share that with you. So don't you go anywhere for the next 45, 50 minutes. Stay where you are. Make sure there's no food on fire, though, so it doesn't burn. And join us.
Yes, join us, actually. We'll just take a recap on what happened last episode. Just in case you think that Plato has stopped talking peace. Actually, we will not stop. We will not stop until everybody appreciates what peace is.
Yeah.
Until everybody actually has peace within him. That was what was a focus last episode when the Baroness hosted Evangelist Ayo all the way from the United Kingdom. And she was here on a mission, and she actually delivered the mission. And the message was, you should have peace so you can give peace. We will keep emphasizing that. The days are quite complex. Life is becoming more and more complicated. So you need load and load. If there's anything like that, if you can quantify it, you need a lot of peace within you so you can give peace to the next person. And so our environment will be peaceful.
And another thing I took home from last week's program was the fact that Reverend John Otu kept on stressing and emphasizing that peace is a process. For so many years, we have been talking peace. We have this peace forum, that peace forum, get people together, peace dialogue, peace talk, and things like that. But we have failed to realize that peace is a process. peace, we should stop talking peace and we should start walking peace. You know, we should start doing things that would make our society peaceful. We should start engaging in peaceful activities. We should show peaceful actions and always have peaceful motives. And I think when we do that, Plateau will be better for it.
And you know, Beit and Anita, when you talk about peace, you know, being a process, and you know, they also talked, Dr. Shola and Pastor Otu, they were unanimous in one thing, that you cannot give what you don't have. That's one. Secondly, let's stop talking about peace, but let's work out peace. Now, I want to say here that until you talk about peace, then you will walk it out, because it is a process. So if we have issues between us, if we do not talk about those issues, we may not be able to work out the modalities to see how we can reach a common ground. So, and I want to say here, even though we said it during last episode, that Plateau State Government is the only state government that has introduced an agency that is working towards peace. And that process that our guests talked about the last episode is actually going on. We may not see, but I know that there are a lot of consultations going on at the local level, and a lot of people, you know, groups are being talked to, and then, you know, how do we get what we're experiencing is relative peace, but we want lasting peace.
That's right.
We will get there. So while that will be going on, because it's a process, it will continue while that is going on. Then let's talk about our lives. You know, our lives too. So,
oh yeah, let's talk about our lives.
Hopefully one day they will all meet at a summit. You know, peace and our lives.
They'll meet somewhere. But you know, you can't enjoy your life if you
don't have peace.
Yes.
You know, it's relative.
We're working simultaneously, working for peace, and then doing some other things that will help us. Today, our focus is back to the woman. We're back to you, woman. You who has been contemplating a lot of things, especially the young woman who needs to know a lot about herself. We need a lot to do. I mean, we need to know a lot about ourselves. So the woman's body is not created in order to confuse her. It is a little complex, just so that it can be handled with a lot of care, because of the lot of things that the woman's body does to create. Am I overdoing it?
No.
You're beginning to sound like an expert.
Like an expert
to anatomy and things like that.
You know the woman's body.
Actually, you said something, Beit, about the complexity of a woman's body. Now, you don't have to really go far when you talk of the complexity of a woman's body. When I was growing up as a young girl, it took the grace of God and a lot of time for me to understand this body, to know, you know, the workings of the body, that I am a woman and the things expected. You know, one of the things that really actually got me, this menstrual cycle. To be sincere with you, it took time. I think it was after my first son that I understood what that thing is.
Okay.
So I am sure there are some people out there like me
who are yet to understand
that thing.
Yes, so today we'll be discussing natural cycle. Do you know what it is? Natural cycle in relationship to IVF. IVF, natural cycle IVF actually. Do you know what it is? You can trust we have someone in the studio about that. None of us here has any idea.
We have an idea of what natural cycle is, but natural cycle and IVF.
Natural cycle IVF.
Now, that is something.
That one is okay.
So Nene will introduce.
Yes.
Oh yeah.
Nene will introduce our guest, who will be doing justice to this discussion. And I say justice because I know he will do justice to this topic.
Today, it is my singular honor and privilege to introduce to you a man who is well known in his field of endeavor, a man who is not only known in Plateau or Nigeria, but is a worldwide renowned, you know, specialist, and he's always been with us anytime we have issues like this to talk about. None other than the consultant gynecologist the IVF specialist that we are proud of in Plateau State and Nigeria, Dr. Kenneth Eguda. Thank you so much for joining us on the Baroness.
Yeah, thank you very much.
I don't want us to go too hard. This.
Okay. No, I'm not going too hard.
We're going to start on a very light note.
I think
you know at the beginning he mentioned that one of our episodes with him was watched on YouTube by one of his bosses. Please tell us more. We want to like before we go further.
And of course, it's just to let our viewer know.
That YouTube page, yeah, is active. It's active.
If you miss it, just go online and
all right, just tell us some more.
Yeah, thank you so much. And as always, it's always very interesting being on the Baroness and talking about or discussing the issues that plague the African woman so much and trying to make them understand, just as you said, the complexity and simplicity of the woman's body. Yeah, back to the question you asked, I worked in several hospitals in England. One of them was Derby Royal Hospital. Yeah, that's University of Derby Teaching Hospital. Actually, that's a new name. Create Fertility Center in England. I shadowed there, so I have a boss there when I'm undergoing my shadowing or my trainings. So he watched, I think, one of the episodes that I was showcased, or rather that I featured, and he was very happy to hear all the things that we talked about, because in that center I actually learned about pre-implantation genetic diagnosis, because we talked a little about it on that episode, and he was glad to hear, I'm sure, what his students or his subordinates was discussing in Nigeria, Africa, in this part of the world. And he gave a lot of thumbs up for that.
Wow. Oh yeah.
Well, we take part of that thumbs up, because anyway, it goes to you, Dr. Ken, but we're happy to know that we're just not talking about the YouTube channel here. It's real, so you can always take advantage of that. And we're not too excited just because someone watched from England. No. We're more excited because the information that we dish out is going places. The most important thing for us is for somebody somewhere to have his question answered. I mean, unquestioned answered, because he didn't even ask. But information that we dish out just answered some of the questions and bring relief to people. I mean, that is where our joy is.
But it's
so I mean,
the issue of IVF, and the fact that Dr. Ken has told us here that one thing that makes his own practice of IVF to stand out is standard. Meeting international best practice. Now, for somebody whom he has worked under, to hear him talk on a local program beamed out internationally, I think this will send a message to them that people in Africa, this part of Africa, understand what IVF is, are getting information, relevant information on what IVF is, and that the treatment is accessible, to them. So it's actually a joy. And as Anita has said, when we say check out our YouTube channel, we're not just talking, it's there. It is there. So if you miss any episode of Baroness, look us up on YouTube and you get to watch the full episode of that program. And that is why we always say that there is no better partner than the Baroness. We're looking for you. Partner with us and you'll be sure to get international coverage.
Okay, and enough of the marketing. Let's go on.
We need it.
Yeah, we need it. What we want to discuss today, Dr. Ken, natural cycle IVF. You've introduced something to natural cycle. So can we break it, then you bring it together? Okay. Let's break it.
Yeah,
Let's
natural cycle first.
To refresh our understanding, that is, if we understand it fully, then you add the IVF to it.
Okay. Yeah, thank you very much for breaking down the topic into natural cycle and then the IVF. Natural cycle means natural, something that comes natural, just the way the body physiology designed for it to go, without necessarily any alteration in the flow of the processes of the woman's cycle. You know, the woman's cycle is in stages. The natural cycle is in stages. If I start using the uterus, the womb of a woman, I think the cycle is divided into three phases. You know, you have the cycle where, the part of the cycle where menstruation occurs. You know, after menstruation occurs, then you have a development of the eggs, the follicle, called folliculogenesis. Then after folliculogenesis, you have the ovulation. After ovulation, you now have menstruation again. Yeah, some part of the cycles are intermingled. They don't classically divide into three the way I dividing them. Some other persons may say that you have the stage of egg development, which is folliculogenesis. Genesis means beginning, of course, of egg development. You know, the follicle is what contains the woman's egg. Okay, so you have that stage first, then you have the ovulation phase or the secretory phase. After ovulation, you have a lot of hormones being secreted to support pregnancy in the event that pregnancy occurs. Then if pregnancy fails to occur, you have a breakdown period that menstruation now occurs. So that's the natural cycle, and it can the length varies from 21 days to 35 days, and that is the uninterrupted natural cycle. Some have their length at 21, some 28, some 30, 35. Yeah, that's the range of what we consider normal natural cycle.
Is it age specific? The cycle
variation?
Itself, the variation, does it have to do with age and the like?
Yeah, you see, a lot of things affect the natural cycle of a woman. One, the age does affect it. You know, the age does affect it because at extremes of ages, you have a lot of irregularities, either becoming too long or too frequent at the extremes of ages. You know, yeah, but there are disease conditions that also affect the natural cycle. You know, some because of the presence of some metabolic diseases or some abnormalities with the ovaries may see their menses after a long period of 3 months or even 6 months, while the presence of some abnormalities in the womb of a woman, like fibroid or a polyp in the lining of the womb, can make it more frequent. And when it becomes more frequent, it goes along with some other abnormalities that may interfere with the woman's ability to get pregnant. You know, so age affects it kind of, but then it differs. You know, the length varies even when nothing is affecting it. You know, between 21 to 35 days. That's a natural cycle. Then, if you're adding the IVF to it, I've established that in the natural cycle, no alteration is done to it, no medication is given. It just flows. It just comes according to the person's pattern, according to the person's physiology, which may differ from one person to another. You know, no drugs are given, no drugs controls it. The body controls it based on the body's rhythm. So natural cycle IVF is the kind of IVF that you just follow the natural body rhythm. You know, you don't give drugs, you don't give unnecessarily, you don't give drugs. As against the conventional IVF where it's all about drugs. You use the drug to control
everything,
the hormones, you take charge of the body, administer all kinds of medication sequentially in stages until you get the eggs, until you now also get the baby fertilized, the embryo fertilized and put back, and continue supporting with all kinds of drugs again. Natural cycle, most of the drugs are not given.
Dr. Ken, I need to break in now. You know, I was listening keenly with when you said, you know, natural cycle is the body, the flow of the body.
Oh yeah.
and then IVF.
Oh, yeah.
As against the other one that drugs controls everything.
The standard or conventional.
Or rather,
IVF.
conventional, yes. Now, natural cycle IVF. It is a common belief that IVF is drug controlled, related, everything.
Yeah.
So how is it possible that there can be a natural cycle IVF when someone is maybe, or rather a woman is having difficulty maybe in conception? So where does the natural cycle come in? Because it is,
If it's natural,
if it's natural, why don't exactly, you know?
At what point do you establish the fact
That is it.
It is a problem that can resolve
Naturally.
All right, I think I need to explain maybe vividly or clearly what the natural cycle
Please do.
IVF means. Yeah. Then in the natural cycle of a woman, one egg, it's usually produced. You know, so in doing a natural cycle IVF, you monitor the woman, and you get that one egg, the oocyte or ovum that is being produced. You retrieve it in the theater. You understand? Then you fertilize it. And after fertilization, you put the embryo that is developed, one embryo in most cases, back into the uterus. That is natural cycle. Little or no medications are used in the natural cycle, you know, and IVF is done. The process of fertilizing the baby occurs outside. You know, but going back to the question that you asked, you say if we term it natural, why don't pregnancy just occur? Yeah, you don't do IVF until there is a need to do IVF.
Okay.
That's one thing we need to establish, until there is a need for IVF. For a woman to require natural IVF, she would have a reason, or what we call an indication for the IVF.
Okay.
It means that it has to be established that conception or fertilization cannot happen in her. She is a normal woman that is cycling normally, having a normal menstrual calendar, producing her one regular egg, and but yet there are reasons why she will need the natural cycle IVF. Maybe her tubes are blocked.
Okay.
So yeah, so you don't need to. Her tubes are blocked, or the husband doesn't have adequate count of sperms to enhance or to achieve fertilization.
Okay.
You know, and sometimes at the extremes of age, you know, where the conventional IVF doesn't seems to produce requisite response to the barrage of medications that are used. You know, you could monitor a woman on her natural cycle and just trace the one egg that she's producing, retrieve it, fertilize, and put it back. So it's a little different from what you anticipated, or what you anticipate, that natural IVF, we talk natural, why doesn't she just conceive? No, IVF comes in when there is a problem with conception. But whether to go the natural cycle of a woman or the conventional cycle of a woman depends on some factors.
Okay, so it is this natural cycle IVF is just about the issue of conception. It has nothing to do with the cycle of the woman itself. It's just the cycle is natural, except that IVF comes in at the point of conception. Where there's difficulty in conception.
Yeah.
Okay.
So what are some of these? Okay, maybe let's find out. How do you track such a woman, or what are some of the determining factors to say this woman is there's nothing wrong, and then all you need is just track her egg and all of that? And
you wanted to add another question to it?
You know, I was, you talked about natural circle. Now, there could be people that the circle may be natural, but the flow isn't. I don't know if I'm able to make a sense here.
natural circle without
a natural circle with maybe inadequate flow. Let me use that term, if it will make sense. You know, maybe the person used to the circle used to be 3 days, but now it's just 1 day. You know, as in the menstrual thing. Maybe it used to be 3 days, but now it's 1 day. And then randomly, you see a spot and it goes away like that. So are these some of indications of...
Okay, if you have classical abnormalities that may alter development of egg, it is one of the reasons why natural cycle shouldn't be undertaken for such an individual.
Okay.
You understand? Yeah, for you to do natural cycle IVF, you have to be established that the person or the woman in question is cycling properly. Well, you could have 1 day menstrual cycle and still generate egg.
Okay.
You could have 1 day menstrual cycle and still generate egg. If the evidence are there that you still generate egg, you can be monitored on the natural cycle and the egg retrieve and fertilize. And by the way, that was the very first type of IVF that was ever undertaken in the world.
Okay.
Yes,
1 day menstruation?
Yeah.
Yes, you once mentioned
that was the first IVF. The first IVF baby in the world was delivered through a natural cycle IVF. Then medications were not even developed.
Available.
Yes, they were not developed. You know, the mother had blocked tubes, but she was producing her eggs. You know, you need the tubes for the eggs to go through to meet with the semen, the sperm of the man. You know, but in that case they were blocked. You know, so but the 1 egg was tracked, retrieved at the end of the time, and fertilized and put back. So you have people who will meet the condition for natural cycle IVF. Currently, natural cycle just reinvented itself again. Yes, and had made a resurgence into the practice of IVF. And the reasons are, one, because of funds, because of finance. You know, we see that there was a resurgence of natural cycle IVF for the past 10 years. If you remember, the last time we had a financial meltdown, global economic crisis, all right, the drug needed for the conventional IVF usually is very expensive. That is what mops the cost of IVF most of the time.
Okay, Dr. Ken, you talk some more about the... Okay, let me use this loosely. The second coming of
natural cycle IVF.
We'll discuss that when we return. The Baroness is still the program, and we are discussing natural cycle IVF. Are you not inquisitive? Please stay with us, and you get to know more about it.
Never a dull moment on PRTV.
Never a dull moment on PRTV. Much more exciting moments on The Baroness with Nenedum, Beit Moanyam and Anita Malu every Tuesday 4:30 p.m. and Friday at 10:30 a.m. on the TV arm of PRTV. The Baroness.
Giving women,
youth,
children and vulnerable groups in the society a voice.
Join us.
We may have to fight internal violence when the insurgency dies down.
What we discussed last week
Was on children.
is when an aspect of this violence
Against
that's
children.
been meted against children, especially the girl child.
Word of advice would you have? Because we have a lot of young people who are aspiring to leave the shores of Nigeria for those greener pastures in those other countries. And those greener pastures, that kind of green pasture almost cost Tony his life.
Never a dull moment on PRTV.
Never a dull moment on PRTV. Much more exciting moments on The Baroness with Nenedum, Beit Moanyam and Anita Malu every Tuesday 4:30 p.m. and Friday at 10:30 a.m. on the TV arm of PRTV. The Baroness.
Giving women,
Youth,
children and vulnerable groups in the society a voice.
Join us.
Natural cycle IVF. Of course, who else will be our guest in the studio except Dr. Ken Oguda of the AFS Hospitals and Diagnosis here in Jos. And you know that he is fertility expert and he is also a specialist in IVF, not only in Nigeria but worldwide. So we have been discussing that with him, and just before we went on break, he was trying to explain what necessitated the revisiting of natural cycle IVF into the world of
assisted reproductive. That is what technology.
Assisted reproductive technology. I want to sound like I don't have to
you want to sound like one of us.
No. So please, Dr. Ken, would you talk some more about that?
Yeah. You know, we have this global financial crisis then, and the cost of running the IVF treatment, or the overhead cost of the client or patient became very high. And now, so as against not doing the IVF at all, this is a woman who probably produced 1 egg monthly, and she has a very valid reason or indication for an IVF, and doesn't have enough money to go through the IVF process. Natural cycle, because medications are not used in the sense of real conventional IVF, you know, you follow the 1 egg, you know, and you may, you know, my word, try to choose my word careful. I say medication are not used in the sense of conventional IVF. You may use some medication to delay her ovulation, so you can retrieve the eggs.
Okay, at the time
that you want to retrieve it, you know, yeah. Then you fertilize the 1 egg, you know, and watch the way the egg goes. If it develops well after fertilization and the embryo, you cannot transfer the embryo back into the womb of the woman. So as against not doing IVF at all, because you don't have money to go for drugs, you know, and you know, the drugs actually cost like half of the cost of IVF. Wow. Takes half of the cost of IVF, you know. So a lot more people who still produce their eggs can now use that 1 egg in doing IVF. There are a few centers that do them in Nigeria. Few centers, I can't mention up to 5.
Your center is one of them?
My center was one of them. In fact, I underwent a special training for this in London and Italy, you know, and there are other reasons why natural cycle IVF can be done. You have older women.
Sorry, Dr. Ken, you know, you mentioned finances as one of the challenges. Now, advantage of natural cycle. And you were almost talking about older women and all of that. Now, what is the advantage of natural cycle IVF as against the conventional IVF? What is the advantage?
Yeah, this question is kind of a little bit technical, you know, and I must say it's a very nice one. You know, for conventional cycle IVF, you use a whole lot of medication. You take over the woman's system completely. You downregulate her, you stop her pituitary or part of the brain from producing hormones, you know, so that you can bring your graduated quantity of hormones in the name of the medicine, the drugs used, and administer for over a period of time. She produced a lot of eggs, you know, maybe 10, 5, 8, some 20. So when these quantities of eggs are produced, they infuse a whole lot of hormones again into the body of the woman. Then, for those who understand the science of implantation, a woman that has 5 eggs, for instance, or 10 eggs, has a lot of progesterone in the system. That progesterone narrows what we call the chance of implantation. She has plenty eggs, but the chance of implantation lower. You understand? So you do all that and she may not get pregnant. But in natural cycle, the body works the way it wants to work. Even when you use some medication to enhance or augment the production of egg in the same natural cycle, maybe you have 2 or 3 eggs, which some people produce naturally when they have triplets or twins. You know, you don't have that hormone challenge, so you have a very brilliant window of implantation. So suffice it to hear at this point that implantation is actually better
in natural cycle
IVF. But then the problem with natural cycle IVF is this, because she's producing only 1 egg, you know, at every age, a woman has both the good and the bad eggs. And the older the woman gets,
the uglier it becomes.
The more the bad eggs. She has more bad eggs. So maybe that one egg produced may be a bad egg. And so it may not go. So cycle will be cancelled. So, you know, the treatment cycles are cancelled regularly. I mean, more frequently than in conventional IVF. Then if you are actually worried about the hormones, for those who are who worried, I know you said say the hormones are high, so why should I do that? You know, the embryos can be frozen. Can freeze the embryos in conventional IVF now. Then allow the hormones in the woman to abate, to go low to the normal level, then allow her natural cycle to still come back up. Then you transfer the embryos within a natural cycle or a prepared cycle where you do hormone replacement therapy. And when you're doing this hormone replacement therapy, you're actually giving low doses of this medication in a way that the windows are not narrowed again, as against when you do that stimulation, you have plenty of eggs. Then the natural cycle IVF can be done every month.
Ooh. Every month.
Okay. Once you terminate, that's the advantage.
Exactly, that's the advantage.
Once you terminate one, you can start another
immediately. Yes, so you can do that every month, low cost, every month, and hoping you get good egg at any point in time. And then, of course, for those of us who were trained in it, you know, there are medications you could use even within the natural cycle to help in preventing early ovulation and what we call early luteinization that may damage the eggs, because the eggs may be damaged because of the way natural things go sometimes. You know, so those are things that can be done. Then there are some people that cannot stand the physiological impact of drugs. Those that have like stage 3, 4 cardiac disease, because some of these medications, for instance, increase the blood volume, because water accumulates in the body, and that's what makes them add weight after using it for a long time. There are people that small accumulation of water in the body, fluid in the body, may be of negative impact to the heart. So you may want to avoid that. Then some people that have some early stages of cancer, instead of stimulating, and you have so much hormones that can maybe aggravate the stages of the cancer, you know, natural cycle, you take out the eggs of the woman. Then if she's fit for you to do implantation, you do implantation. And if she's not fit and there is a surrogate for you to have this implantation done for, then you can go ahead and do the embryo transfer into the surrogate. And this woman with her cancer, or this couple battling cancer, still have a chance of having a baby by one means or the other. So the complications with natural cycle is very minimal, if at all there is. Yeah, because the feared complication with the conventional IVF, for instance, is what we call ovarian hyperstimulation, where a woman's abdomen gets bloated, the ovaries are enlarged, swollen with a lot of cysts, and she accumulates water in the abdomen, peritoneal cavity. That hardly ever happens with the natural cycle IVF. So there are no much physiological challenge on the woman undergoing natural cycle IVF. And above all, in this our environment where funds are usually a big challenge, natural cycle IVF comes in handy. You know, there's this slang when we were in school, then they say at all. Nine bad. You know, so as against not doing at all, you try with the natural cycle.
Yeah, you might be lucky.
Yeah, the chance actually is high, because good implantation, if you're within the good age, then of course, you know, there are people who don't respond well to the classical medications of IVF, but on their own they still produce egg by some means that
some miraculous means.
Struggle to understand. You know, so you could get those eggs, get them fertilized and transfer into this woman, and they have a fair chance to becoming the mother that they desire to be. So natural cycle IVF, I think, is very, very good for the sub-Saharan African environment, or societies that are battling economic crisis like Nigeria.
So I want to understand, you know, there are times when people get married and after 2 months it becomes an issue. 2 months, no pregnancy, they carry matter for head. You know, so how long should one stay before you establish that you even have a problem for you to start looking for a solution? Is it immediately, a month, 2 months, or how long?
Yeah, maybe let me add to the fact that some people are very meticulous, so they know their cycle is operating very well. I mean, it's going as expected. It's very smooth, and so they wonder, why would I not take in? And after a month, 2, 3 and on like that, and then they Dr. K, why are you laughing?
You made it sound as if conception is automatic.
Okay. Well, that's what we think.
Thank you. That's because you're in Nigeria, you're in Africa. You know that we expect that pregnancy should be the next thing.
In fact, it should be automatic. You know, Dr. Ken, if you have a mother-in-law who has already told the son that she's waiting for him to get married and give her grandchildren before she dies,
okay,
you can understand the anxiety, the trauma that women of such men go through.
Then I think this answer is going to be good to women of such men and to the mother-in-laws of such women. You know, that conception is not automatic. And sometimes a couple do not necessarily know that they have challenges. You can be ovulating and your cycle is like you're 100% sure you're ovulating. But it's not all about ovulation. Pregnancy is much more much more than ovulation. You can't be ovulating, you know, and your tubes are not okay, or your husband's sperm is not okay, you know, or the quality of eggs are not right, or there's some metabolic challenges or diseases somewhere, diabetes or polycystic ovary that is tampering with the quality of eggs. So ovulation comes every time, you know. In fact, it's possible for you to even pluck the eggs you're ovulating and see the eggs, and pregnancies are not coming. You understand? So if I add this to the question you asked, as soon as you get worried that you're not getting pregnant, go see the expert. That's my take on that. You know, while I was doing my gynecological training, or rather even in the classical definition of infertility, they say it is only when pregnancy hasn't come for 1 year for younger couples, or 6 months for older couples 35 and above, that you should see the doctor. But from where I am coming from, and from the social revolution in the world today, I think the moment you think you have challenge conceiving, in fact, maybe before your first intercourse in marriage, go see the doctor. If is that real for me? Because a woman, for instance, who doesn't menstruate for 3 months, and it's a routine for her regularly, and she's getting married, pregnancy won't just happen, because there's a sign of a problem already. So why do you have to wait till 1 year? It's to add age and decrease quality of eggs to that to yourself, waiting for another 1 year. What about people that are married at the age of 40, 41? If I'm a lady, for instance, marrying at 40, 41, before I even get married, I'll go check with my doctor. Yeah, that is the level we should take fertility care to. Yeah, and it may not be right to mention it at this forum, but whether we like it or not, it's in our environment. You have gay couples. So, in fact, before you get married, you know you have infertility. You understand? So you see a doctor and do what you have to do if it is permitted in the environment you live. You understand? So it is not automatic that's to get to be pregnant. All things must work in synchrony. The sperm count okay, the movement of the sperm okay, motility, the word okay, the look, the resemblance, or morphology of the sperm must be okay, and the woman should be producing eggs. I mean, good eggs, and not just any eggs. You know, and tubes must be okay. Then her health should also be okay, and she also shouldn't have been on some damaging medications. There are medications that prevent pregnancies. So ask me, the moment you think you're not getting pregnant and you're already getting worried, check with the doctor. And if you're marrying at a very advanced age, 37, 38, wow, plan your pregnancies with the doctor. Don't wait. Yeah, don't wait. You don't need to wait. And so that's why I say that the definition based on the practice is changing, but the academic definition still remains. Yeah. So once you think you have some concerns about pregnancies occurring, it's an avenue to see the doctor. And for me, the doctor shouldn't tell you are worried. No, because a good number of doctors, from my experience, would tell you that you're too anxious. Go and stay, hang on for 1 more year. Oh man, I'm not going to hang on for 1 more year, because that lady knows what's chasing her. You know, so why hang on for 1 year?
Where will she hang on
for 1 year and it
on?
continues up for 1 year? It's better to evaluate such a couple and discover that there is no problem and ask her to stay. I mean, why do you even think there's no problem? There's always a problem. It's just that
you're there.
It's just that you have not discovered what the problem is.
Yeah,
if a woman doesn't get pregnant when she has intercourse, there's a reason for that. It's either that the egg she produced that month is not good, or the sperm wasn't good enough, or the tube was not there. Okay, just something is responsible. There's always an answer to anything.
Some of us are victims of this. That is why I'm sure they're asking, because they check you and they say, you don't have any problem. Just go, relax your mind.
You're so anxious.
It will happen.
Yes,
it will happen. I mean,
it doesn't happen 1 year, 2 years,
I think I like what you said, Dr. Ken, that if you think, if you start to worry that you have not taken in, just go to the doctor. Don't imagine. Don't even, assume, because this cycle that you think is so perfect is not perfect after all, because some other things are affecting. It is not just about your cycle. The pregnancy is not just about cycle. It's just part of it. So you have to take care of every other thing, knock out every, possible problem, so that, because I see a lot of people in that respect, and it is unfortunately your people, your colleagues, that do tell them to go
and hang on.
Relax.
No, they should go and hang on. To what? I do not know.
I want to know, where is the place of the man now, the husband, in the natural cycle IVF? Does a man have a place?
Does he have a role?
A very important role, or is it just a woman thing?
Well, the man has plenty of rules, as much as his wife has a lot of rules to do. It takes two to tango. It takes two to get pregnant. The man's sperm is needed for the natural cycle IVF to be done, whether normal or abnormal. Natural cycle IVF can be done just because of the man too. You remember, and the woman undergoing IVF may not have a problem. The man may be the problem. Maybe the sperm count is low, or something wrong with the sperms. And you have to have some currently 15 million to 20 million sperms to make a woman pregnant. That's by the so-called automatic pregnancy, spontaneous pregnancies. You understand? Right. So if it is low, natural cycle IVF is okay. So the man has a role to play, to pay the monies, to pay the bills, to be a good companion, and to be a good companion, to be of emotional support to the wife as she's undergoing all that. Then to be involved in the discussion and planning with the doctors and his wife, and they should be in harmony while all that is happening. So the man has a lot of role to do. It's his sperm that is going to be used, except of course if they're dealing with a case where there's no sperm and a donated sperm is going to be used and all that. But despite that, the man has a role to play.
Dr. Ken, something is running in my mind.
I hope it's not going to take, because
I know our time is fast gone, but I'm looking at what he said about medications that can cause your hormones to either go haywire, or even medications that could prevent conception. Now, is it possible that maybe in the course of trying to get a solution to problems, people get diagnosed or rather get drugs legitimately? Now they go to hospitals and they're given drugs, and then these drugs affect them without really knowing, negatively affects their ability to conceive negatively. Is there a chance that happens? And when it does, how would you know that it is a drug that has caused it, or it's just something that happens?
Okay, if I start from the IVF medication itself, we give the IVF medication.
Yeah.
You understand? And often, or sometimes, you don't know the profile of response you anticipate. Or you just find out sometimes that this woman is responding so out of range. You understand? And you have a responsibility here. You need to counsel with the woman. These eggs are too many. We have options of what to do. At at every point, the woman's autonomy overrides. But you have to balance the autonomy with sound medical knowledge and counseling. If you think that with what you're doing, you're not going to achieve anything, you discuss with the woman, hey, these drugs have caused this, and we need to bank this egg and allow the effect of the drug to clear out of the system. Then we put the fertilized eggs back when your system is okay. Then there are other medications that can prevent implantation. You understand? Like the NSAIDs, the pain-killing medications, diclofenac, for instance, cataflam, they prevent implantation. You understand? So when you are anticipating implantation, a woman complaining of pain, you don't go rushing, giving all kinds of painkillers. Just like some people ovulating naturally, and now they don't take diclofenac, cataflam, ibuprofen. Those drugs prevent implantation from happening. You could take them earlier on, and when you are sure that be washed out of the system before implantation. But if you take it through implantation, you may just compromise implantation. There are a lot of medications that fall in these categories. She needs to discuss with her doctor what medication that she's on extra. So then, of course, there are other medications like the antihypertensives, the lisinopril, for instance, that can cause abnormality with the kidneys of the baby if the baby is born or with some blood vessels. So she needs to discuss with the doctor. So those medication that needs to be changed should be changed, and the one that needs to be encouraged will be encouraged. Then, in order not to produce excess eggs, we have another concept of IVF now we call the minimal stimulating IVF. Because every time this IVF undergoes revolution, from the crude days where no drugs were used to this refined days where conventional IVFs are done, and now we're having plenty eggs, then to now the era of safety in IVF where we have minimal stimulation. So you stimulate the woman minimally for so many reasons. For religious reasons, for those that think that if you're doing excess stimulation, you have excess eggs, what do you with them? You waste them, you commit religious sin, then those, and all that. So there are a lot of reasons. But for health, we stand for the safety of the woman.
Yeah.
So you do minimal stimulating IVF, where you have minimal eggs, minimal eggs, so that you don't have complications of the ovarian hyperstimulation and failed implantation. I know when you have too many eggs, you now start thinking of banking the eggs, and that's extra costs again. So if you can avoid that, you need to do all you can to avoid that, and the way to avoid that is to be properly schooled in IVF. And in the nature of the medication, and in the dosing of medication, and how to monitor quickly so you can detect early excessive response, and to take steps to prevent them, and also how to manage the complication. So there is a lot of place for training and retraining and back to natural cycle.
In fact, back to natural cycle.
I think we are advocating for
natural cycle. Yeah.
Yes.
For our society, where there's no money, don't stay at home and think that there's no money. Just go and find out. Natural cycle IVF may just be the solution where you don't have the money.
Okay, I think go to where natural cycle IVF is done. Like if you go somewhere like our hospitals and diagnostics, if you go somewhere else, like you mentioned, in this country there are 5. So if you go somewhere else that they are not experts, they are likely to tell you it's not possible. Don't listen to such stories. Please go to the right place. It is your chance. Just explore your chance of achieving pregnancy and making your home happy the way you want it, or rather keeping your marriage for those whose marriages are threatened because there's no baby. Anyway, we will rejoice with you on the other side when you will have taken advantage of that and have achieved pregnancy. The Baroness are grateful to you, Dr. Ken, for being here.
Always,
and I'm sure those who have watched have really been educated and now know they are armed and know what to do with their lives, whether they're married or they're yet to get married. Well, thank you so much, viewer, for being with us, and my colleagues here, thank you.
If you missed this edition, remember that you can, the lines are on the screen. You could send an SMS, with your name and your location, ask your question, and then we will, of course, get you the response that you need. For as many people as have asked for Dr. Ken's number, we have always done the needful by forwarding it to you, and we know that you've also made contact with him. Annie will give you our Facebook page and the YouTube channel to get us on.
For those of you who want to get in touch with us via social media, we have our Facebook page, www.facebook.com/The Baroness PRTVC, or you can send us an email, thebaroness.prtvc@gmail.com. Don't forget our YouTube channel if you want to watch the program or past editions of this program. Our YouTube channel is The Baroness PRTV. Let's meet again next week.
Thank you, everyone that has made this program what it has been. Our supervisor has been Yakubu Tadi. And of course, we will not forget our producer, Esther Nasara, and the Baron himself, the General Manager of PRTBC, Jefta Jagden. From all of us is bye. Till next time.
From STDs.